I have a dream that one day this nation will rise up, live out the true meaning of its creed. We hold these truths to be self-evident, that all men are created equal.
For a number of years, the Negro passengers on the city bus lines of Montgomery have been humiliated, intimidated, and faced threats on this bus line. Just the other day, one of the fine citizens of our community, Mrs. Rosa Parks, was arrested because she refused to give up her seat for a white passenger. Mrs. Rosa Parks was arrested and taken down to jail, taken from the bus, just because she refused to give up her seat. At present, we are in the midst of a protest, the Negro citizens of Montgomery, representing some 44% of the population. 90% at least of the regular Negro bus passengers are staying off the buses, and we plan to continue until something is done.
Well, we hope to achieve equal rights as any human being deserves. That's what we are working for.
What do you think the prospects are for achieving that goal?
I think we'll be successful if we continue.
Freedom and justice. I have a dream that my 4 little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. I have a dream today.
Hello, and welcome to Martin Luther King's virtual tour and Riding with Rosa Parks. My name's Fred Garcia, and I want to welcome you here today as we explore 6 nonprofit organizations in the city of Waukesha that promote Dr. Martin Luther King's dream of service to the community. 57 years ago, Dr. Martin Luther King's dream rode into history on a bus. As you remember, Rosa Parks refused to give up her seat to a white passenger, which set off a series of events that led to desegregation in the South, and started Dr. Martin Luther King on his dream of equality for everyone. Here we are at our first stop, the Hispanic Community Health Resource Center. Let's take a look and see what they have to offer.
Hi, I'm Tiffany Steffen. I'm the director of the Pro Healthcare Hispanic Resource Center. Our mission is really an extension of Pro Healthcare's mission to continually improve the healthcare of our community. We do this in collaboration with other nonprofits in the community. The Hispanic Resource Center is funded by Waukesha Memorial and the Waukesha Memorial Foundation. The Hispanic Resource Center promotes the Martin Luther King philosophy, and that we really do believe we would like to provide access for all.
The Hispanic Resource Center has been here in the city of Waukesha since 2001. We have 3 positions within the Hispanic Resource Center. The health promoters provide education and outreach in the community. Most of the programs focus on prevention, such as exercise programs, car seat, the Happy Baby program. The client advocates assist with the many health-related services. This past fiscal year, we have seen just under 8,500 clients.
And here we are at our second stop, La Casa de Esperanza Clinic.
My name is Lee Whitley. I'm the manager of La Casa de Esperanza Clinic. I have been the manager for the last 11 years. The mission of La Casa de Esperanza is to provide opportunities to the community to achieve full and social economic participation in society. La Casa de Esperanza Clinic in particular serves individuals who have problems with substance abuse and mental health issues. La Casa de Esperanza Clinic in the last year has provided services to 40 uninsured and underinsured individuals. The funding for La Casa de Esperanza Clinic primarily comes from the state of Wisconsin and also the county. We also have providers like the Fleck Foundation. We promote Dr. Luther King's dream by reminding ourselves of the mission of La Casa de Esperanza Clinic, which is fostering hope and opportunity for those individuals that want to prosper and make a healthy lifestyle. We have been in this location since 1999. La Casa Clinic at the present time has on a monthly basis an average of 125 active clients. We also offer mental health and substance abuse services. We work with the school district, we work with the county, we work with WCS, the Wisconsin Community Services. At the present time we have 6 psychotherapists, master levels.
And here we are at our third stop, Interfaith Senior Programs.
I'm Kathy Gale, Executive Director of Interfaith Senior Programs. We're a faith-based, community-centered, nonprofit organization helping seniors and adults with disabilities to remain independent in their homes of choice for as long as possible. We work with 75 Waukesha congregations, helping to recruit volunteers and to identify people in the community who need our help. We also place senior volunteers throughout the community, in schools, nonprofit organizations, and government agencies to respond to whatever needs in the community can't be addressed through normal channels. Our agency receives funding from the United Way in Waukesha County, from federal, state, and county government, and from various community sources, including Waukesha congregations, businesses, community groups, and the people we serve who donate as much as they can to help our program. What I'd like to share with everybody is that there's a place in Waukesha County for everyone to provide service to the community, whether it's 2 to 3 hours once a year, or you're the type of person who can volunteer 40 hours a week. Get involved. That's what Dr. King wanted us to do.
Each year, we provide services for 1,200 seniors and adults with disabilities, and we engage volunteers throughout the community. More than 800 retired and senior volunteers are helping in schools and in nonprofits and government agencies throughout Waukesha County. Here in the agency, we have 20 volunteers who help every week answering telephones, putting projects together, and making our mission possible. Right now we're working on our holiday giving program. We collect donated gift cards for pharmacies and grocery stores, and we distribute them to 500 low-income isolated seniors and adults with disabilities throughout Waukesha County. Every weekday we have community volunteers who come into our office and call out to other volunteers, coordinating their schedules with our clients who need rides to doctor appointments, pharmacies, and grocery stores.
And here we are at the Waukesha County Community Dental Clinic.
I'm Renee Ramirez, and I'm the Executive Director of the Waukesha County Community Dental Clinic. Our mission is to provide and to advocate for quality oral health care services for those who are disadvantaged and who live in Waukesha County. Our vision is to improve health care so children can go to school and learn, and for adults so that they can go to work and be productive citizens. The Waukesha County Community Dental Clinic is generously funded by private and public foundations, federal, state, and local grants, and very generous individual donors from around the state. The Waukesha County Community Dental Clinic promotes Martin Luther King's dream by truly being a service to the community, by engaging the community in our mission, making smiles healthy and happy all over Waukesha County. The Waukesha County Community Dental Clinic serves low-income families from all over Waukesha County. Every month, more than 500 appointments serve these low-income children and adults who have emergencies. The clinic is open Monday through Friday, 8 a.m. to 4:30. We charge no more than $20 per visit for people who don't have insurance. The clinic is staffed by paid staff, and we also supplement the things we do by volunteers from all over Waukesha County. Each year, volunteers provide more than $200,000 worth of dental care to these low-income families. Our oral health impacts our physical health. More than 3,200 children from all over Waukesha County now call us their dental home.
I'm Major Carol with the Salvation Army of Waukesha, Wisconsin. My husband and I are the Corps officers here. Our vision for this community is that we are a beacon on the hill, a lighthouse for people who have needs in our community. Our mission is to meet the human needs of mankind without discrimination, and also to open up opportunities to speak the gospel of Jesus Christ to the folks who come to us. Our funding sources would be about $100,000, a little over $100,000 from United Way, a few grants that equal maybe about $100,000, and then the rest is general donations from within the community of the County of Waukesha. As the Salvation Army officers, we are also pastors, so we're in our chapel now. We hold services here on Sunday. We have Sunday school, youth programs that have a spiritual emphasis to them. We often do spiritual counseling with people who come to us and have that need. Another example of our programs is the Christmas Assistance Program, where children are registered and receive gifts and coats and other items of clothing. One of the basic needs programs that we offer here at the Salvation Army is a meal program offered 3 nights a week, a hot meal, nutritious hot meal. And you would envision with me that there's about 110 to 120 people who come here 3 times a week for those meals. This computer lab is sort of our pride and joy. We received a $25,000 grant from the Target Foundation, so we offer computer classes strictly run by volunteers at this point on Monday, Tuesday evenings, and Thursday evenings. An important element to meeting basic needs in our community is providing food. We provide bags of food for people during the week. They can come in once a month and receive bags of groceries and the commodity program. I think most people in the community are pretty familiar with the shelter that we offer for homeless men. We are able to keep 31 men here, but oftentimes we're full to about 40 guys. I think that we would meet the dream and the plans of Martin Luther King by serving our community at where the need really exists.
Here we are at our final destination, St. Joe's Medical and Dental Clinic.
I'm Jennifer Evans, Executive Director of St. Joseph's Medical and Dental Clinic in Waukesha. St. Joseph's Medical and Dental Clinic is a lifeline for people like Jackie. Jackie's a 48-year-old woman who has worked all of her life. She has 2 grown children, and in fact, she and her husband were working on a farm when she was suddenly struck ill. Jackie was not able to work, and because she and her husband didn't have health insurance, they lost their job, their home, and Jackie almost lost her life. But thanks to our medical case manager, she was able to work with agencies in the community to obtain a regular place to live, and she was able to see a doctor, obtain medications, and the tests that she needs to manage her condition. We're supported primarily through United Way funding and private donations from individuals and groups. St. Joseph's Clinic is different from a community clinic, which accepts Medicaid and Medicare payments. We're part of the free clinic system that provides access to donated and discounted services for our clients. Martin Luther King said that of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. St. Joseph's Medical and Dental Clinic addresses this issue by providing healthcare services to the disenfranchised, the low income, and the uninsured.
We have been in business for over 35 years, and we serve uninsured and low-income residents of Waukesha County. We're able to do this because we have a network of over 130 volunteers who donate their services either here at the clinic or in their offices. We also have partnerships with over 60 different clinics and Waukesha Memorial Hospital, which make it possible for patients to receive diagnostic tests, medications, and specialty care. We have exam rooms here where doctors see our patients. We are grateful to St. Joseph's Church for donating facilities to the clinic so that we can provide services to our patients.
I would like to extend a special thank you to all of the organizations that participated in today's event. Let's remember Dr. Martin Luther King's dream and legacy. As he once said, it takes a community to provide services to those in need. Together, we can see the dream.